causes pain and disability, and its ocular specificity in the supraspinatus tendon. The treatment consists short waves, use guide articulation, arthroscopic surgery, but what do we do in the failures? The use guide aspiration barbotage technique has been shown to improve shoulder pain and friction. In associated rupture of the calf, we could associate plasma rich in international platelets. The hypothesis was barbotage plus PRP could be safe and effective for the treatment of symptomatic calcifying tendinopathy of the supraspinatus tendon. Two objectives: evaluate clinical results, evaluate the effects of the resorption of the calcium deposit, tendon integrity, and analyze complications. This is the study design, 1 year, 12 consecutive patients. You have the inclusion criteria, exclusion criteria. This is the epidemiological table. All the cases were performed by the same physician. And the Garner classification, 1, 2, and 3, depend on the density of the classification. This is the technique that we do, the technique of punction, aspiration, barbotage, used for PRP. We put 2 milliliters of lead-plaquetas, 2%, the equilateral. We start softly, gently, we push, and then we start to see the syringe with the calcium deposit, and then we start to see the lesion, the rotator cuff tears, because we think this is a really tear of the rotator cuff, and then we start to remove all the calcium. It's depending on the Garner classification, obviously. And then, when we saw all the resorption, we have to be careful with not extract the hydroxyl calcium deposit in the bursa, because the bursitis clinica will be painful later. And then, when we finish with 2 or 3 syringes, it depends on the case, we fill all the tears with PRP, 3 millimeters inside of the lesion. We call it nidus of the lesion. You see it very clearly, nidus. And then we put 6 millimeters of PRP in the bursa. We repeat the procedure 2 weeks later, only with PRP in the bursa, and 4 weeks later, the first session. This is our laboratory, Laboratorio Seville. You know the procedure of the PRP, it's not new. We characterize the PRP with a hemocontador, activate with calcium chloride, we concentration of the factor 2.2. Statistical analysis, we use Excel program for passing graph and comparison of the result of mass and dash scores, and ERS study program for capturing relevance and p-value calculation. This is the result. The average age, it was 51 years and BMI 24. The result of the 12 patients, only one required surgery due to the loss of improvement in symptoms after 2 months of evolution. Another patient had no significant clinical improvement at 3, 6, and 12 months and is waiting surgery. This is the comparative graphs with VAS. Of the remaining 10 patients, 9 had a statistically significant improvement in the VAS and DASH scale, and 6 and 2 and 12 months of follow-up, and 1 had a statistically significant improvement on both scales of 3, but not 6 and 2 months. This is one example. We have no complication related to the procedure. Only 3 patients manifested intense pains at the first day, treated with analgesic. A complete resorption of the calcium deposit was observed in 8 patients. However, clinical improvement occurred in 9 patients at 12 months of evolution. You have the result with the VAS scales for pain in the arm, shoulder, and hand disability questionnaire of 3, 6 months and 3, 6 months. This is the result, clinical improvement, the VAS scale, and this is the same for the DASH scale. Okay, in the discussion, we can say that washing by use guide barbotage has superior result than corticosteroids, even for the calcium deposit of more than 5 millimeters. Currently, PRP is a valid treatment for the tendinopathies based on studies that have shown favorable results, such as enable epicondylopathies and patellar tendinopathy. We have considered association barbotage plus biological therapy protocol with PRP poor in the leucos and with a concentration platelets 2.2 with respect to the whole world. The result of our study showed a statistically significant clinical improvement in 80% of the patients at 3 months and 75% at 6 and 12 months follow-up. Complex resorption of the calcium deposit was present in 66% of patients. Limitation of the study. There was no control group to compare the efficacy with other treatment. The course of patient is low and the heterogeneity of calcium. The conclusion, the calcific tendinopathy of the shoulder is a relatively frequent pathology. At the same medical act, we can perform the barbotage technique plus PRP. It's a simple, effective, cost-effective procedure with a few complications that significantly reduce the size of the calcification and pain in most patients, benefit use of the first choice. It offers good results in more than 75% of the cases, so the number of indications for surgery has decreased drastically. However, prospective, randomized, and control studies are needed to evaluate the real efficacy of the different types of treatment for this methodology. Thank you very much.